Hey, this is Dr. Charles on Man Crush Monday. Dr. Alan Charles. I'm going to go ahead and show you how to put the proper way to put on your PPE during this coronavirus epidemic. Chris is obviously 6 feet, actually greater than 6 feet away from me recording this. First, you want to make sure your hands are clean, which mine are. Then you're going to put your N95 mask on, which is a really good filtration mask. There are 2 straps here. I'm glad I did that so I can show you. There are 2 straps here. The one with the yellow on the top goes on over your head on the top. When you put it on, you put both of them on like this. And then you take the one with the yellow strap and you put it on the top like so. And then you tighten it. You should make sure, again, like I was saying, that the black little foam is pinched tight around your nose. And you should be able to have a nice tight seal so that nothing gets in or out of here. The way this works is that it filters particles. Oxygen is small enough, should be small enough to go through so that you can breathe, and CO2 pretty much can go through it as well. However, obviously it is difficult to breathe sometimes with it on because it is very snug on you, and it will leave like little pressure marks around you. So you'll see a lot of your healthcare providers with pressure marks around their face. Next, I'm going to put on this mask. This is just a regular surgical mask. It's not custom fit, and truthfully, unless it's custom fit, it's not gonna really protect you as much as most people think. But it is better because you're not getting any splashes or sprays or anything. So I put that over this just to add a layer of protection. You can change that every use and change the other one either every use or every couple of uses. And then we're gonna go ahead and put my goggles on so that I don't have any splashes, things splashing in my eyes. And the goggles have this spill guard here and the spill guard here, so nothing gets into my eyes. These masks can get uncomfortable sometimes because it puts a little bit of pressure on your ears, but better safe than sorry. And then we're going to put our face shield on. Face shield on here so that it looks like right here, but it's not right here. And some people call it, the Darth Vader Stormtrooper mask here. And that's pretty much the bulk of it right now. Then this prevents anything from spilling, kind of creates a barrier and allows me to see as well. It's just for your own protection, better safe than sorry. Then you can go on ahead to the sink, wash your hands. Go ahead on first. Okay, you're gonna go on to the sink, wash your hands. And your traditional 20-second wash. Really, really hard. More soap because I like to use a decent amount of soap. Wash all the way up here. And I don't think most of us know how to wash our hands to begin with, but you really want to get in there and get all the stuff from within your hands out. I'm kind of going hard even though I've already washed it about 100 times today, and right before we started this video I washed it. So I'm gonna go ahead and wash it at least 20 seconds. I do a little bit longer sometimes, but you just want your hands clean. The reason why I did that is because now that I put everything on after washing my hands, I'm gonna touch some other stuff, and I don't want to touch my face again with not clean hands. And then, just dry your hands like usual. Make sure it's nice and dry because you're not going to be able to get gloves on if your hands are wet, right? So, usually say wash your hands past your wrist. That's a safe place to be, at least past the little wrist bone, your ulna bone. That's what it attaches. Hard to talk wearing this stuff because it should be, because it's sealed, and maybe a little bit hard to breathe as well. So there we go. And there's a trash can here. Now I'm going to put on my gloves. Since this is just for a regular cleaning appointment, you don't necessarily need a surgical glove. This will suffice. This box is new. I just opened it. And we usually have a purifier and a particle collector in the room to collect any particles while we're doing any of our procedures. So pretty much the room is clean, and we mop after each and every patient and change the barriers and so forth. Now I can go ahead and put this on. This is actually sterile. Normally it would already be like unfolded, so this may not be the best. Typically it's already unfolded and someone helps me get in it, but staff's on lunch right now, so and then I would put this on. My staff would normally help me put this on, but like I said, they're out at lunch right now. But you would put this on like so, and somebody would come and tie me up, and that would be pretty much it, except for the fact that I grabbed the gown myself. Normally the staff would just have me walk into it like this with clean hands and whatnot. The same with the gloves. Okay, and if we're doing surgery, we actually wear surgical gloves, and the staff has that ready for me to kind of glove up. Traditionally we do that anyway, depending on the procedure, because if you're going into doing any kind of surgery, such as implants or all-on-4 full mouth rehab, then you kind of want to make sure you're sterile and keep the air clean. And we usually have our patients rinse with antimicrobial mouth rinse before we start anything, just to make sure everything is clean in there. Obviously coronavirus is a virus, but we do want to just, even before coronavirus, we have their mouth clean before we, or at least sterile as we can get it, and disinfect it before we can, before we even clean anything. But that's it. Thank you for watching. Have a great day, man. Man Crush Monday.